The hospitals are very strict in their safety protocols when it comes to treating a person with COVID-19. That is why home care of COVID patients is considered dangerous, as other family members could also catch the virus. But given the current state of the healthcare system with hospital running in full capacity, some have no choice but to undergo home treatment. According to the interim guidance of the World Health Organization, not all COVID positive could be provided at home care. It is necessary first to have the clinical evaluation of a doctor if home treatment is recommended. Those who are not suitable for home care are patients who are 60 years old and above and with risk factors for severe disease. On the other hand, asymptomatic or those with mild or moderate disease could be suitable for home isolation and care. According to WHO, caregivers and household members should receive guidance from a trained health worker adhering the following recommendations. Limit the movement of the patient around the house, avoid entering the room of the patient, or maintain the 1 meter distance. Limit the number of caregivers, avoid visitors, perform hand hygiene. Patients and caregivers should always wear masks. Materials used to cover mouth and nose should be discarded or cleaned appropriately. Avoid direct contact with the patient's body fluids. Do not reuse medical masks or gloves. Gloves and protective clothing should be used when cleaning surfaces or handling clothing with body fluids. Clean and disinfect surfaces. Use dedicated eating utensils for the patient. Place contaminated linen in a laundry bag and avoid exposure to contaminated items from the patient's immediate environment. According to Dr. Bong Santiago, a general internist, it is important to consider the ventilation of the COVID patient's room. Always make sure he or she is well hydrated and avoid alcoholic drinks.
Sinasabi sa mga bagong studies ngayon, prone sa COVID infection or recurrent infection ang mga pasyenteng mahihina po ang dalan ng pag-inom po ng alak, no?
Patients who are experiencing cold and fever can take over-the-counter medicines.
Kung meron tayong sipon, meron namang mga over-the-counters na pwedeng inumin para sa sipon natin. Ganon din sa mga sore throat na karaniwang complaint ng ating mga patients na may COVID. And yung lagnat naman, of course, kung hydrated tayo, plus the benefit of taking over-the-counter paracetamol, 500 mg para sa mga katandaan, every 4 hours, every 6 hours, pwede namang mainom yan. Over the counter, makukuha natin yan.
But still, it is important to strictly monitor the patient's condition as it may need to be hospitalized.
Baka papunta na to sa mga medyo severe symptoms na ika nga, meron ng ubot-sipon at medyo hirap ng huminga, no? Hindi makakain, may panlalata, mababa ng BP, o kaya may mga sakit ito na dati pang nasa kanila na medyo nagiging uncontrolled. Pag ganitong mga sitwasyon, ganitong kondisyon, most likely they need to be hospitalized.
Nel Maribuhok, UNTV News and Rescue. We serve the people, we give glory to God.